Great. Hello, I'm Dr. Zenobia Ursuliak. I'm a psychiatrist with the Nova Scotia Early Psychosis Program. We see patients that are living out in the community who've been diagnosed with a psychotic disorder. And by psychotic disorder, I mean someone who may be hearing voices, who may have very disorganized thoughts, so they're not able to concentrate, not able to study in school or focus on their work, and who may be very paranoid, believe that someone's out to hurt them, that the FBI are following them, or maybe even believe that they're the son of God. So very severe mental illness. So we see people who are not in hospital but are living out in the community. We help stabilize their illness by providing them with medications, with help through social work, occupational therapy, recreational therapy, psychotherapy. So that's my job as a psychiatrist. There's 4 areas that I'm really concerned about as a psychiatrist. The first area is where people who have been supported on a disability, who weren't able to work because of their illness, who are now able to get back to work. And one of the problems is that they're getting back to work, but they may not be able to work full-time hours. And after a certain number of hours that they work per week, they're cut off from disability. So they won't have that financial support, but they're not yet able to function at full-time levels. So they're kind of caught being cut off from disability and not being able to work enough to support themselves. So they're basically the working poor. And I think that really prevents them from being able to have a full recovery. So that's one scenario that I'm really concerned about. The second scenario is the same type of case where they might even be able to work for full time. They were previously on a disability, and the disability paid for their medication. And these medications can be very expensive, running around $300 to $400 a month. So these people have been cut off from disability support, and they're on, they're working at a job full time, but they might not be making that much money. They can apply for provincial pharmacare, but even the payment of about $120 for provincial pharmacare is a substantial barrier for these people to make when they're living off of maybe $1,000, $1,200, $1,500 a month. So those are people that I'm really concerned about. The third group of people are people who need supportive housing, either to live in a group home or to have some sort of liaison with their landlord, so that they don't get kicked out of their housing every time they have a slight relapse in their illness and start to maybe get disorganized again or start to talk loudly and the landlord doesn't understand. So having access to housing where people may have the supports that they need, I think is really important and is an area that I would like to see more work with community services around. And the fourth area is a huge area that affects the ability for our patients to actually come and seek help and be able to admit that they have an illness, and that's around the area of stigma. And it's present in our society today at the, which is sad to say, but we have no provincial platform to have an anti-stigma campaign. I mean, the Schizophrenia Society is trying to combat stigma, but I'd like to see the psychiatrists and the provincial government get together and really make a strong stigma campaign, because I think that stigma really affects, especially people with psychotic disorders, from seeking and sticking with help that's going to help them get their lives back.